Thank you, Mr. President.
Thank you, Mr. President.
I rise to speak about the ways in which small businesses will be helped in this bill. And before my colleagues leave the floor, had some of them stayed at the negotiating table, perhaps some of the provisions that they've talked about could have been considered. But since they pretty much packed up their bags months ago and left the debate and just come to the floor to talk, it really is, it's very difficult to put any of their provisions in the legislation. There were some amendments that were accepted both, I know, in the Senate on the Finance Committee and the Help Committee. But the fact is there is a lot of choice in this bill. There are a lot of choices for individuals, for small businesses, and there's help for Americans and for businesses, not only in the state of Louisiana, which I represent, but all the states in the union. Because as you can see, Mr. President, without reform, the cost for small business will rise from, or the jobs lost because of the lack of reform will rise from 39,000 to 70,000 to 103,000, 137,000, 178,000. These are jobs lost because small businesses are having a very, very difficult time affording premiums and because of the lack of reform in the private insurance market, which this bill also provides. This trend line will continue unless we do something. And that's why many of us are here working early in the morning, through the middle of the day, into late at night, trying to figure out the way to reform this system. So I really respect my colleagues. I know them all very well, and they made their statements to the record this morning. But the fact of the matter is, Mr. President, we've been at this since Harry Truman was the president. We can't throw this bill away and start all over again. There is choice. There's expansion of Medicaid and reform to the Medicaid system. There's going to be a strengthening and reform of the Medicare system. And in the middle, there's great strength and reform of the private insurance market. And I am a very strong supporter of choice and competition. But I came to the floor today to speak about a segment of our population, 27 million to be exact. That's the number of small businesses, Mr. President, that are depending on us to do our very best work on the Patient Protection and Affordable Care Act that is pending before the Senate as we speak. Our economic prosperity as a nation, as you know, as a former governor of Virginia who helped bring millions of jobs to your state, and now as a leader, Mr. President, on small business yourself, you know that the economic prosperity of our nation relies in large measure on how we can help our small businesses become the economic engines that we know they can be to help lift us out of this recession. Entrepreneurs roll up their sleeves and go to work each and every day. They go early to work, they stay late, they create jobs, they push the envelope on technical advances, and they assume the risk necessary to succeed in the private marketplace. Small businesses created 64% of American jobs in the last 15 years, according to the Small Business Administration and others. And yet, as chair of the Senate Committee on Entrepreneurship, I've heard time and time again from these same business owners that they cannot afford to operate in the current broken healthcare system, and they desperately need us to fix it. And that's what this effort is underway. Small businesses have been hard hit by premiums that are regularly increasing at 15%, 20%, and in many cases, Mr. President, 45%. This is the cumulative cost of health benefits. You'll see in 2009, $156 million. Without reform, $1 billion. Without reform, it's going to go to $717 billion. And then in 2015, exceed the $1 trillion mark. This is what happens if we do what my colleagues are urging us to do and do nothing, or to start again. We have been, as I said, since Harry Truman was the president, trying to figure out a way to provide each and every American with affordable health insurance, either through the public or the private sector or some combination of the above. That's why this bill is so important, because without reform, this is the price our small businesses will have to pay, and it is too steep, it is too high of a mountain for them to climb. Without these reforms, as I said, costs are expected to more than double over the next 10 years. But, Mr. President, this debate is not about numbers. It's about people. People like Mike Berry, who owns Hobbyworks in Laurel, Maryland, and who was here just last week in the Capitol to speak at a press conference. I've had hundreds of business owners from all over the country come, and Mike is one of the last ones to come and speak at a press conference last week. He said to us that his plan not too long ago cost only $100 a person, most of which he was happy to cover as a company. Over the years, however, his premiums have tripled. His employees have seen their costs go 5 times higher as they pay more of their premiums, up to almost a $1,200 deductible. Mike said, and his words are echoed by business owners in my state and business owners around the country. He said, those of us who do provide coverage are slowly being dragged down by these costs, something that we once considered a benefit. A benefit, he said, I was proud to provide, has now come to be seen as a burden to be feared because you just don't know what's coming next. He went on to say, after years of astonishing rate hikes and declining competition among providers, many small businesses like mine may be only 1 or 2 years away from having to cut their health care programs entirely. I'm not going to let these premiums, he said, put me out of business. I'm just going to say we can't do it anymore. And Mr. President, this is what's happening all across America. Only in about 15 years ago, 65% of small businesses in our country offered affordable health insurance, something they were proud to provide, full and comprehensive coverage, many of them picking up a majority of the cost. Today, that has dropped to 39% and dropping every week that we fail to act. Small business owners like Mike from Maryland, small business owners like hundreds in my state, need meaningful health care reform. The Senate health care bill contains measures that responsibly put in place both intermediate and long-term insurance reforms that are very, very important. Let me start with the immediate benefits. I understand that there's some, including myself, that would like to see more immediate benefits here, but these are some that are important, substantial, and real. Temporary reinsurance for early retirees will be available under this bill. This will help many in a very tough stage in their life. States may establish exchanges to get kind of a jump on, of course, the mandatory date that is in the bill. No annual limits and restricted lifetime limits. This will be a very important benefit to small business. Reporting medical loss ratios. For the first time, insurance companies will have to report information that will help keep the costs lower over time, bring more transparency and accountability to this system. The bridge credit for small business will go into effect almost immediately. It will help businesses that have 10 employees or 25 employees to provide health coverage for their workers. And then in the intermediate time frame, there are some additional. The exchanges will be set up by 2014. When people talk about choice on the other side, there's going to be plenty of choice in this bill for uninsured individuals, for those that are in small businesses up to 100 employees. They will be able to access these exchanges, look for affordable options, and that is going to be a major improvement over the current system. There's a bridge credit, a credit that I call a bridge credit, a bridge to the exchanges for small businesses. And then once the exchanges are up and running, businesses will be able, 10 and 25 employees or less, to be able to get almost 35% credit for the insurance they provide. And that, Mr. President, is in addition to the deductibility that they have in the current law. I'd like to ask unanimous consent to speak for another 5 minutes.
Without objection.
Thank you. Well, one of the major criticisms of this bill has been the cost. The bill does show fiscal responsibility, cutting budget deficits by $127 billion in the first decade and $650 billion in the second decade. You know, anything we do is going to cost some money up front to fix the system. But the way that this bill is being designed is that for every dollar that's spent, there's a dollar raised to pay for that change. That is, you know, a refreshing change of method, considering the last 8 years where bill after bill was put on this floor, whether for domestic or international priorities, not paid for at all. So, you know, we can be, you know, criticized for trying to push something, a major reform forward, but at least we're finding ways within the system to pay for these important changes that will hopefully drive down cost for everyone. As Mike reminded me, the gentleman that spoke at our press conference, he said, it's even more important not to let one problem prevent you from solving another. So while we do have budget deficit problems, and we're very, very sensitive to it, we can't allow that to stop us from doing anything else. What we can do is, as we work on the other things, do it in the most fiscally responsible way possible. That is why I and many members of the Senate have said we're not prepared to vote on anything until we get a final CBO score to make sure that not only can we afford it, and not only have we paid for it, but that over time, premium cost will go down. Cost to the government will go down, both federal and state level, as well as to small businesses. Let me just say that the Business Roundtable reports that these exchanges, both in the near term and the intermediate term, could reduce administrative costs for business owners by as much as 22%. And business owners can get back, if they're making shoes, they can get back to making shoes, Mr. President, not running around looking for insurance that they can't find, and if they could, it's too expensive for them anyway. If they're building high-tech equipment or electronic equipment, they can get back into the business of doing that instead of being in the business of figuring out insurance actuarial tables. So reducing administrative costs for small business is important. 22 million self-employed Americans have even more unpredictable costs. Their premiums have risen 74% since 2001. These exchanges will help them also reduce administrative cost. And I'm proud that one of the amendments that I have pending on the Senate floor would give the self-employed a 50% tax deduction so that they can be on a similar playing field, if you will, for the small businesses and large businesses that enjoy favorable tax treatment under the current tax code. It's been mentioned before, but insurance companies will no longer be allowed to arbitrarily raise rates or drop coverage. Instead, companies will be forced to compete on the price and quality of their plans, not by underwriting the least risk. The bill also has no employer mandate. Instead, we have a shared responsibility for businesses with more than 50 employees. 96% of small business in America are exempt from the provision of required coverage, but we have come to terms with a system that requires individuals to purchase insurance as well as small businesses to provide insurance with the proper tax credits and subsidies that help them make it possible. To help small businesses more immediately bridge the affordability gap, these exchanges will not be up and running until 2014. Again, there's an amendment to push that up. I hope we will be able to do that. But in the bill, tax credits will help about 51,000 businesses in my state of Louisiana alone. There are millions of businesses that will be, or hundreds of thousands of businesses that will benefit, 51,000 in my home state of Louisiana alone, because of the credits that are in the bill as we speak, and through the amendment process, we're hoping to enrich and expand them. While these provisions in the underlying bill are strong for small business, there's always room for improvement. That's why I, along with many of my colleagues, have introduced a series of amendments. Some have a cost to them, like the 50% deduction. It's a $12 billion cost. But if we can find it in the bill, if the mark allows us to find $12 billion, that would be a good place to spend it, Mr. President, because these individuals, whether they're realtors or attorneys or accountants or sole contractors, carpenters that are working out there creating a job for themselves and creating economic opportunity in their communities, could use a tax cut and a tax credit to help them. There are a series of amendments that I've introduced that don't have any cost associated, just common sense, create more efficiency in the system. I trust the leadership will consider including those. In addition, Senator Lincoln, under her leadership, has an amendment to expand both the bridge credit and the tax credit. It's a $9 billion provision, but we're hoping that the mark will allow for that addition as well. I want to just mention a few other things in my closing. I want to thank the small business owners and organizations and advocates, Mr. President, that have remained at the negotiating table. They didn't pack up their bags and run away, but they stayed here in Washington, in state capitals, on telephones, in conference calls, in public meetings, in the debates taking place in the many, many committee rooms to argue for this kind of reform, for choice, for transparency, for insurance market reform, for tax credits, more favorable tax treatment to help them afford the insurance that they know is the right thing for them to do. It's a smart thing for them to do, and most small business owners want to provide good health insurance for their employees so that they can compete for the best employees out there, which helps them to keep their businesses strong. So I want to thank the small business owners, particularly the small business majority, many of the women business owners organizations that have stayed at the table to help negotiate this important bill. So in conclusion, as we move forward, I'm prepared to work with my colleagues here in the Senate to pass a meaningful and responsible health care reform for small business. We have a historic opportunity here in Washington to fix a system that is broken, that is in desperate need of repair. Let us not let this chance slip away. In these final days of negotiation, let us come together to find a way forward. Again, one that reforms the private insurance market, strengthens Medicare, and sustains its viability over a longer period of time, helps to improve the system of Medicaid by hopefully providing poor, middle class, and wealthy people with more choices of health care. And by coming to terms, Mr. President, that we're not going to have an all-public system, we're not going to have an all-private system. We're going to have to find a middle ground where we take the best of both sides of a public and private system and put them together so that every American can have insurance they can count on, and most importantly, that our small businesses can have insurance that can help them create the jobs necessary to lead us out of this recession, to start turning this deficit situation around and creating wealth and prosperity for all Americans.